Hey, Dr. Josh Wagner here with Patient Mastery, where we help amazing chiros become the go-to in your community, double your profits, double your collections, more time off. Quick video sharing with you how we do reactivation texts inside Patient Mastery and giving you exact verbiage to use, how to do it, because of this question on social media of a doc saying, hey, we have a text message service for appointment reminders, but what about all the people who haven't been in for 6+ months and reminding them? There's phone calls, there's physical letters, there's emails, and there's texts. Physical letters take a lot more energy and cost. Phone calls take a ton of energy from your team. Emails don't get seen that easily, but texts are statistically the most viewed medium of communication. That reminds me, I'm confronted with it every single quarter. 4 years ago, I went to a doctor in Beverly Hills. Got a procedure, it was actually for my hair. Went well, awesome, super grateful. Since then, every single 3 months, I get a voicemail, like a minute long, from the office manager, who's a really good office manager, saying, hey, we're checking up on you, how are you doing, do you need anything else? And I'm just thinking, wow, it's been years. If she's calling me, how many other hundreds of people is she calling every 3 months? And one, who checks their voicemail? It's an annoyance and a bother to me. I have no interest in anything else. And all of that could have been, all that time that she's wasting as a front desk of a high-end surgery center with an automated text that goes out to everyone. And we're gonna show you that right here. So I'm not saying your CAs shouldn't be actively actually calling people, but once it gets past 1 year, the likelihood of someone coming back or reaching them drops lower than the worthwhileness of having your CA call them. Leaving voicemails, pretty much unnecessary. Who should you be calling? The patients who you have the best connection with, you want them back in, which is not every patient, and some of those you could do yourself as the doc, and 90% your CAs do. But man, years later, leaving voicemails every 3 months, such a waste of time. So here are some examples. In PM, we have 4 samples, and that would be quarterly. So every 3 months, a text message to, it could be all of your normal patients, it could be just your inactives within the last year or longer, or it could be the whole group, it doesn't matter. You're not bothering anyone with a simple text. But I'm gonna share 2 with you right here that is super simple. These are money makers. First one, this is so simple, and so many docs don't do this super simple thing. This could be text and email, but we're focusing on text today. And this is reminder when doc is gone. At certain points during the year, most likely you're taking off. Maybe it's an extra long weekend, maybe it's a full week off, it doesn't matter. At certain parts of the year, that's gonna happen. When you text patients 3 weeks before you're leaving, so we're in mid-October right now. Let's say you're taking Thanksgiving week off, and I don't even know when the dates are, but let's say the first week of November, you send out a text to all of your inactives saying, hey, the doc is taking off, doctor's gonna be gone, taking off from November 20th to 27th this month. If you wanna be seen before then, schedule an appointment here, and then have a scheduling link in the text. If you don't have the ability for online scheduling, then of course, say reply or call us. Now, you may not think it makes sense, but when you send out this reminder a few weeks in advance saying the doctor's gonna be gone, so if you wanna make sure you're seen before then, and you don't wanna be out of luck if something flares up, or if it gets worse when the doctor's gone, schedule now. Docs inside Patient Mastery get, I don't wanna say dozens, but like, imagine if you get 5, 6 reactivations from that one single text that isn't sent manually to every single person. It's sent at once to the entire database, because there's text systems that do that. Literally as simple as that. Hey, first name, wanted to let you know the doctor's gonna be gone from date to date. If you wanna be seen before then, schedule here, call us, reply to this message. As simple as that, you will get reactivation. The next one is, what's new in the practice? And I'll show you what that means, because everyone likes new, especially if it's beneficial for them. Now this may be something that happens once a year, maybe twice a year, probably not too much more than that, but what's new might be an associate or CA. It might be a new service you're offering. a new technique you learned. All of these are cause to celebrate. All of these can be considered something that's maybe of interest to patients. Like, we're doing this new service that helps with XYZ. We've learned that the doctors learned this new technique that helps with frozen shoulder, migraines, breached babies. Doesn't matter. No one cares about the name of the service or the service. They care about what it helps with. So it doesn't matter if you got laser, shockwave, decompression, choose your modality of the year, you know, whatever's popular. But no one knows what shockwave is. No one knows really what decompression is, but they know what conditions are. So helps with, you know, disc injuries, helps with tennis elbow, helps with ankle injuries, frozen shoulder, whatever. Obviously celebrating a new team member or especially a new doctor in the practice. So when you share what's new, just that communication of everyone sees text messages, it puts you in front of their mind. Just like it's smart to be emailing every week, but most people aren't going to open the emails, that's fine. They just see it in their inbox, or maybe not. It may be going to spam or promotions, but text messages go through to people's phones. And even if it's not something they're super interested in, it keeps you on top of mind of you're their doctor, you're there, maybe someone in their family needs you, maybe someone they sit next to at work, maybe someone they just had coffee with or drinks with or dinner with, a friend was talking about an issue, and it keeps you top of mind. Text messaging, one to all, not one by one, super, super valuable. And you can use these two immediately. When's the doctor leaving next? And something that's new in the practice, and you will get reactivation patients, and it will be even easier if you have an online scheduling that you can insert in the text so people don't have to actually manually call you or go back and forth. You gotta have online scheduling that's super clear and simple. If it's not as simple as ordering Uber Eats, it's too complicated. And I do see a lot of chiros online scheduling just as complicated as applying for a mortgage. Like, you have to create an account, verify your email, and create a password. It's like, no. If it's harder than scheduling a pizza, it's harder than scheduling an Uber. People are going to your competitor next door who does have easier online scheduling. You should check out, as a patient, as a fake patient, you should check out your online scheduling on a mobile phone and see how easy is this, and then look at some of your neighbor competitors, and if they have easier ones, find out what service they use, get that service. Because this makes or breaks how many tens of patients you will get a month just by how easy it is to schedule. Okay, hope this helps. And as always, if you want one-to-one help taking your practice from where it is to the next level with the PM proven processes, just duplicating them, installing them, patient-centered, getting paid what you're worth, getting patients following your recommendations and love showing up in the practice, reach out, patientmastery.com. We'll show you exactly how we do it for you if it's a fit for your goals and your practice.